Now that you know it's completely normal the first few weeks after cesarean, what I would suggest with the swelling is to get some compression on right away. Get compression on after day 1, gentle compression, wear it for the first 6 weeks generally, and wean yourself off after that. Every body is different, and if you have questions about compression, I ran a huge workshop about it a couple of Mondays ago, so just go back in my Instagram grid and I talk all about what types to get, when to start, how long to wear compression for, how to do it right, what things to look out for, how to do it wrong, all the things. So compression, day 1 to week 6, it'll help with swelling, and it'll definitely help with that C-section shelf appearance. While every body is different, your best shot at changing the appearance of your C-section shelf is in the first 6 months post-cesarean. Okay? It doesn't mean you can't make a difference after the 6-month mark. That's not what I'm saying at all. But your scar tissue is the most valuable during this time. For you to be doing your own scar massage yourself, not having to see a therapist on the regular. Okay, so take advantage of this window. Make sure you learn your scar massage. This will decrease the tightness and the how stuck that scar tissue is to the tissues below. No, it's never too late. Here's what I want everybody to hear. Your body is a machine when it comes to adapting to load. So that means, your scar tissue is living and breathing. It means it can change at any time. Now, the older it is, the tougher it is to change. But it doesn't mean it can't change. The older it is, that means you're probably going to need to use different techniques and maybe even tools. That being said, if you've never massaged your scar before and you're years out, definitely I've seen differences and changes in the first 2 years postpartum with the moms that I've worked with. Start now. You'd be shocked at how such a little bit goes such a long way. And it's just 5 minutes a day. It's one of these things that you can absolutely learn on your own. The C-section shelf can be changed while you're pregnant, but I would not recommend to try this on your own. See your perinatal therapist for a one-on-one in-person assessment, just to make sure that, if there is pain associated with it, if there is difficulty with engaging core control, etc., it might not be shelf-related. It might be something to do with your pregnancy. So try not to go about diagnosing yourself during such a unique time of life. This is really a time to be seeking professional guidance. Pain in your cesarean scar is often caused by a scar that is too tight and stuck down or adhesed. So the treatment for that is scar massage. So if you've never tried scar massage, I really implore you to give it a shot. It's so easy to do at home by yourself. You don't have to be a therapist. It's very easy to learn. And the effects are pretty shockingly quick. Now, caveat. Pain can be caused by a whole bunch of other things. Weakness, infection, certainly injury or movement pattern issues that cause pain, and often other systems as well. So don't assume that your pain is just from tight scar tissue. The best thing to do is to get your pain assessed by a therapist. In my definition of a C-section shelf, no, a diastasis or a hernia won't cause this appearance. But hang on a second. Every body can benefit from postpartum exercise. Like, diastasis recovery is 100% a part of cesarean recovery. And a lot of moms don't know that your diastasis, everyone gets a diastasis, by the way, 100% of people. And a cesarean surgery effectively cuts through your diastasis between your belly button and your pubic bone. Did you know? So So it is absolutely, hugely important for a C-section mom to do diastasis rehab. So does that affect the appearance of the abdominals from a muscular tone sense? 100%. Scar massage is so effective, there is no reason for this to be a best-kept secret at all. You will see improvements in your pain, your C-section shelf scar appearance, your strength, literally within weeks, especially if you are in the first 6 months postpartum. So here's what I would suggest. Start right away. Even if you're years postpartum, if you've never done scar massage, start right away. You would take a scar massage technique and you would progress it according to your stage of healing. So you don't do the same scar massage for weeks and weeks and months on end. It won't make a change after you've achieved the results. You have to progress it. So my biggest suggestion is to follow a scar massage and exercise program. And that's exactly what I have in my Cesarean Recovery for Foundations program. Check it out in the link here below.